If a woman has completed her family size, she has completed her family size, and she's satisfied with the number of children she has, and the woman is very symptomatic, having recurrent heavy menstrual bleeding, having huge abdominal swelling, the best option would be to what? To remove the womb. Yes. And also, you also take, this part of the world, then there's a lot of cultural things to some of the things we do. Many women want to keep their womb till the next life and all that. Some of them, when you counsel them, they'll tell you, this is my womb, you will not remove it. I want to have a womb when I come back to my next life. So a lot of things happen. So you must also have this cultural sensitivity and all that. You shouldn't be pushing. You should give the best, at that particular point in time to the woman. If you consent to your procedure, then you perform it. But by and large, the common reasons why people perform myomectomy, which is conservative surgical, is to preserve that womb for the woman to actually get pregnant. It's a fertility sparing surgery. The second reason why you may want to perform the procedure is probably you see that the mass is becoming so large, it's so huge, it's compressing the kidneys, it's causing hydronephrosis, creating a lot of problems for the woman. Even when that woman has completed her family size or close to her menopausal age and all that, you need to find a way to remove that mass, to perform that surgery for that person. Otherwise, it's going to damage vital structures in that patient. It's one of the major. And then a woman who is having very heavy menstrual bleeding, you may also want to perform the procedure for them, particularly the submucous type, the ones that are located inside the cavity, are more likely to cause heavy bleeding, and such fibroids should be removed. Outside that, there are indications for use of medical therapy. Women you want to use medical therapy are one, to control symptoms. Because I told you that fibroid could come with pain, very severe pain. So, and there are medications that can be used very well to control pain, like the non-steroidal anti-inflammatory drugs. They control pain very well. And some of these drugs, apart from controlling pain, they also control heavy menstrual bleeding. Particularly when you combine them, NSAID, tranexamic acid, mefenamic acid, and all. When you combine NSAID and other medications, they could control both the pain and the bleeding very well. Some of these drugs are non-hormonal. Some of them are also hormonal. Some of these drugs, you can take them orally. Some can be given by injectable method. So whichever way is just to control symptoms. That's one of it. The second reason why you may want to use medical therapy is this. A woman is around her perimenopausal period. She's around 50. She's 49. She's 50. She's 51. And you know that this woman will soon enter menopause. Average age of menopause is about 51 years old, and it's constant worldwide. Average age of menopause. You know that this woman will soon enter menopause. It's possible that, when you give some of this medication, they can shrink the fibroid mass. When you give gonadotropin-releasing hormone analog and some other hormones, they can actually shrink and reduce the size of the fibroid. The reason why it's not effective in people who are still really desirous of fertility is that the drugs are anti-fertility drugs. And sometimes when you leave them, after giving them, they can grow back within the space of 6 months to 1 year. So by the time you notice that the hormonal milieu of these women are going down, particularly women who are around their perimenopausal period, it's possible and it's very easy for you to administer such medications like gonadotropin-releasing hormone analog. Once you give such medication, it shrinks that fibroid mass and obviate the need of even to operate such a woman, because the fibroid is already going down. And you know that when the woman enters menopause, the estrogen level falls, the progesterone level falls, and these are the hormones that potentiate the growth of this fibroid. So you can give them, and probably you may not need to give the perform any surgery on those women. So women who are around their perimenopausal period or just entering their menopause, you can use medications to control those symptoms and prevent you from performing a surgical procedure on them. The other reason why you may want to use some medical therapy is women who are in quote not so fit for a surgical procedure. You can continue to give them some medications. Women can have very symptoms of fibroid and have a cardiac problem, heart problems, and some medical conditions that may not allow you to take them to the theater immediately. Until you're able to stabilize them, they are not stable enough for the surgery. You may then decide to perform the procedure. So these are some of the reasons why sometimes, one may want to use some of these medications, prior to, in some of these women who are having the uterine myoma, uterine fibroid. And then the conservative approach is the myomectomy, in which you want to remove the fibroid and preserve the uterus. This is mainly fertility sparing, to preserve the reproductive potential of the woman. The other option is to remove the whole womb, which is supposed to be the best option for performing this procedure. And this whole thing can be open or closed. There are surgeries, there are fibroid operation surgery you can perform without having to open up the abdomen. Minimal access surgery. You can perform a laparoscopic surgery, and remove the fibroid. If it's within the endometrial cavity, you can perform hysteroscopy and remove the fibroid without having to open up the women. These procedures have emerged over time. They have advanced over time, and they are easy. They are inexpensive, and the complications are minimal, are less. Complications are there, but in good hands, the complications are very, very few, and not as it was, in the days of of our fathers, when these kids were not really there. So it's not a very difficult procedure to do.
I've been receiving so many questions as you were answering the treatment options, but okay, I will take some together as the one I'm asking right now. Still on the treatments, yeah. So somebody is asking right now, let's say she's going for the surgery. After the fibroid surgery, will this fibroid reoccur? So she's scared. What is the chance that if I'm operated, the fibroid will come back? If there's any need to come back, why am I being operated on?
All right. Indications to perform a fibroid surgery should be made. You don't just take a woman to do a fibroid because you want the woman to, or you just want to perform a surgery. First of all, there should be a need to perform that surgery. If that need is not there, no need to perform the surgery. So the chances that fibroid will reoccur is there. The chances is also high. In some cases, it takes a very long time for the fibroid to occur. And this varies for many people. It varies in so many people. Some people take a longer time for it to recur. Some people, within a shorter space of time to also recall. But the chances are not so high. In many cases, if it's for fertility reasons, the person performed the procedure, what we usually advise is that within the space of 2 years, the woman should get pregnant. Because we all understand that nulliparity is a risk factor. Not having a child is a risk factor for developing fibroid. So by the time a woman performs a procedure, and you're still taking up to 4 years, 5 years, 6 years, 7 years, 8 years, the woman has still not gotten pregnant, the chances that she will develop and even be cautious of having more fibroid is there. So we usually say, well, now that we have performed this procedure, you really have to get pregnant. But in some cases, in which the girl is unmarried, you can't force a man into her hands, simply because you are performing a procedure. You can only reassure her and tell her that do the best you can, pick out all the fibroid and be hopeful. Sometimes for such women, what we usually do is we'll see whether we can control the symptoms using medical means in the meantime, pending when she's, prepared to actually get married, or except the fibroids are huge and are also already causing, pressure symptoms, causing some problems for the lady. But if it's just for menorrhagia and the fibroids are few, some of those fibroids can be controlled using medication, depending when the woman is actually ready, to have it done, or when the woman is married.
There is this thing we always hear everywhere. They'll tell you that there's a fibroid curing tea or a fibroid melting tea, or when you take this medication, it will melt the fibroid. As an expert, what is your opinion on that, sir?
There are so many things we hear, very many. The things we hear, even God will be shocked at what we hear. It's very difficult. What we hear, there's nothing you will not hear. Some women even come to the clinic with some drinks and so many things, We've had cases where you make a diagnosis, you first of all go back to a tradomedical home. They have some, vaginal herbs they insert, do all sorts of things until they make it even more difficult for the person to do at a particular time. It's a common thing we have in this environment, particularly those of us who practice within this rural environment. It's very common. So as you can see, if you look at the pathophysiology, you know that there's nothing you drink that will melt anything. Where would they come from? Now, from the mouth to where? From which vessel will they go into the uterus? And then, is it, except they are doing embolization, traditional, they'll find a way to go and block uterine vessels and prevent the fibroid from further growth. It's not there. It's not there. Most of these things are really more injurious, more harmful to these women than, having to come for proper assessment and reassessment. It's important to let them know that yes, there are certain medications we can give you. We will give you those medications and they will shrink that fibroid mass. And these medications are well documented. We have GnRH, we have oral pill, we have all sorts of hormonal medications we could give. It will shrink this fibroid over some time. Although they could regrow, it could give the woman an ample time to prepare for whatever she wants to have. So they must make themselves available in the hospital and then for proper care to be given. Not looking for all the money they will spend for that thing may just be enough to give a permanent solution to their problem. That's the way I see it. Because by the time they have gone around, they spent over 300 to 400,000 naira. And in common good hospitals, government-owned hospitals, fibroid surgery are not as high as that. They are not that expensive. Except in some private facilities, you could have fibroid operation of close to 2 million. At some hospital you can have, but good hospital, federal government-owned institution, it's difficult to find, performing this procedure for more than, many cases, less than 250,000 naira, you've done it. You get what I mean? They are not as expensive as people think. So they should just come and get a better care, proper evaluation, proper diagnosis, and because there are differentials you also need to rule out. If a woman age of 45 and 55 telling you that she's having a fibroid, she's going to, get medication somewhere, you should know that it's not fibroid you'll be thinking of first. The woman who is over 50 years, 55 years coming to you. Not every abdominal swelling is a fibroid. That's what some of them don't know. A woman keeps having coital bleeding. She's having sex with her husband. She's bleeding from the vagina, having offensive vaginal discharge. The vaginal discharge keep coming with the bleeding, particularly at contact, either when she's trying to clean her vagina or she's trying to, meet with her husband or spouse and notice that she's bleeding. And it goes somewhere, it tells you fibroid you have and all that. There are so many things you would think of. Malignancies are also common at that age. So for some of those women, we must be able to rule out that it's not just this fibroid this person has. If it's the fibroid, we will know. That's why that clinical evaluation is very key. Every swelling in the abdomen and bleeding is not always fibroid. And they must also understand most of the things you go to all these herbal places for to go and take medication and say I have fibroids. It's not usually so. You must get proper evaluation in the hospital and get a good and effective treatment. Not just going around to start sipping everything you have.
There are some questions here, but most of these questions have, I think, Chief have actually answered them, and one of them is just answered them within the space when he's talking now. One of the questions I'm saying is that, is there any home or self cure for fibroid? Then
okay.
Should I say the next question?
Okay. Yeah, say the next question.
Okay. He said, thank you very much, sir, for the question, for the lecture. If the woman is satisfied with giving birth and a surgery is carried out on her to remove her womb, is there a 100% chance that the fibroid will not grow back?
Like I mentioned earlier when we started this discussion, I said the definitive cure for a fibroid is removal of the womb. Once the womb is removed, fibroid will not grow anywhere again. Because fibroid is a tumor, a mass that is growing in the womb. So once the womb is removed, fibroid will not come from anywhere again. It's finished. Yeah. So, so once you remove it, it's its definitive cure. If a woman has completed her family size, if the fibroid becomes so symptomatic, then remove the fibroid. Remove the womb. Yes, you remove the womb. Yeah. Yes, you remove the womb.
So
remove the womb.
Okay. It simply means that once the womb is not there, there's no more fibroid, because the fibroid grows in the womb. Yeah.
Yes, okay, exactly. The reason why we perform a conservative surgery is fertility sparing. The fact that the woman has not completed her family size. Yes, those that want to preserve the function of their uterus, particularly for fertility reasons. Although in this part of the world, some will tell you that I want to continue to be seeing my period. I want to continue to menstruate. I want to have my womb back in my next life. You know, people can say all sorts of things, but the primary reason is to preserve the reproductive function of the woman.
Yeah. Those people that always say they want to see their menstruation is because they believe that menstruation is bad blood. So if the bad blood is not removed within their body, they believe that they are not okay. Okay, this other question says, can a woman who remove this fibroid conceive after delaying for more than 4 years after the operation?
Well, like I mentioned earlier, fibroid is not just the only cause of inability to get pregnant. Inability to conceive is a couple problem. Couple means it's not just the man alone, it's not just the woman, it's not just the woman alone. The factors stem from both the man and the woman. So when you are evaluating the cause of inability to get pregnant, you must be able to check the man, look at the sperm, if the sperm is okay, if the sperm can actually fertilize an egg. That's one way to look at the man. The second thing you look at is the other factors in the woman. The factors are not just the womb alone. These factors will also range from the tube of the woman. Are the tube open? If tubes are not open, it means the sperm cannot come out from the tube to fertilize the eggs that are released from the ovary. The woman still will not be able to get pregnant even when you have removed the fibroid in that woman. It's also possible that this fibroid surgery, if it's not properly performed, the woman can develop adhesions. And once the woman develops adhesion, the tube can become blocked. The endometrial cavity of the womb can also become compromised. The woman can develop intrauterine adhesions within the cavity of the womb. And getting pregnant now becomes difficult for the woman. That's why when you are performing fibroid surgery, it has to be someone who can actually do it. Someone who has been trained, who knows how to perform fibroid surgery. Not just somebody you are meeting on the road or just a doctor. Doctors are specialized in different aspects. So you must be able to know the person you are taking yourself to perform that procedure, because it could compromise your fertility potential if it's not properly done. And in some cases, and in many cases, if fibroid was the only cause of your inability to get pregnant and you are married, once the fibroid is properly done, within 1 to 2 years, the woman should get pregnant. If that fibroid was the major delay, the major problem, except there are other issues that have been there. So the woman had to be fully evaluated, fully checked to be sure that other factors are not there that are causing the inability to get pregnant.
Asking me on TikTok, I think we said it before, she missed it. So she's asking, what are the causes of fibroid? So let's take it together, sir. What are the causes of fibroid? A brief recap. And at what age is a woman at risk of getting fibroid?
High risk.
Oh, okay. All right. I mentioned that the real cause why a woman will just begin to grow certain tumors, certain swelling on her womb is not really known. But there are predispositions. There are certain things that could predispose a woman from developing such tumors in the womb. One of it is blacks. Being a black woman, your chances of developing some of these things are already there. Chances are high of developing some of these fibroids. So that genetic factors comes in. That's also where familial predispositions comes in. Like you had a sister who had a fibroid, your mom had a fibroid, you were a twin and all that. If you have a familiar history of fibroid, the chances that you have a fibroid is also very high. Outside that, women in reproductive age group, the fibroid is common in women within their reproductive age group, within women between 15 to 49 years of age. You will find fibroid because the growth of this fibroid is hormone dependent. And what are these hormones? Estrogen and progesterone. These are the hormones. They potentiate the growth of this fibroid mass. Outside this, women who are obese, obesity, women who have very high weight are more likely to develop fibroid compared to women with lower body mass indexes. Is common among them because they elaborate some of these hormones more than just the slimmer women. So cutting down weight is one of the things those women can do to avoid some of these risks which are associated with some of these things they could have. Apart from this, there are certain hormonal therapies some women will take over time that will eventually predispose them to having to developing fibroids. Some of those hormones are there. And then there are also some pelvic infections. Women who have recurrent pelvic inflammatory diseases or other pelvic infections could have uterine. There's an association between developing uterine myoma, uterine fibroid, and pelvic inflammatory infections. The precise how it happens is still not clear, but this association has been demonstrated. That it's been found that is commoner, is also very common in such women. So outside obesity, pelvic infection, women in reproductive age group, genetic predisposition, family lines, a mother has fibroid, sister had fibroid, you had a twin that had fibroid, and nulliparity, if you have not given birth before. If you are 28, 29, 30, 31, 32, 33, 34, 35, 36, 37, 40, you haven't given birth, the chances are also higher that the womb will continue to find a way, to grow some of these fibroids that are there. So the chances are also higher in people we call nulliparous women. Nulliparous women are women who have not given birth at all before. And then women who start menstruating very early. Women who start menstruating very early also have a higher chances of developing fibroid as compared to women who enter menopause very early. A woman who has premature menopause is less likely to develop more complications of uterine fibroid than a woman who is having delayed age at achieving menopause. So early menarche, which is a a woman who starts menstruating very early, they are also predisposition to developing some of these uterine fibroid.
Is it possible that a lady can say, okay, I want to prevent, I don't want to come down with fibroid?
Thank you. It's a very difficult question. Fibroid is very difficult to prevent because in many cases it's sporadic. You won't really have anything to just do about it. It will happen if it wants to happen. Like I mentioned earlier, I told you that over 70% of people have this, at least a fibroid seedling. So it's really not something you could prevent, but like modify, there are some risk factors you could modify. One of those risk factors is reducing the risk of developing, of being obese, of getting too fat. That in itself may not really prevent you from developing the uterine fibroid. It may just only slow down the growth of some of these fibroids if they are there. Because if you don't elaborate most of these hormones, estrogen and progesterone, the chances are very slim that, this fibroid will grow well. So these are some of the things one needs to consider, but trying to prevent it from not happening is almost impossible to do. It's difficult to actually.
How about diet and food? Is there any relationship between the diet and food? Is there any food that you eat that makes the fibroid grow?
Many cases, there are some food that contains some phytoestrogens. There are some food that contains some phytoestrogens, some fat containing that. Any food that will increase your weight. Like I have been saying now, weight control is one of the ways to reduce elaboration of some of these estrogen and progesterone that causes the growth of some of these fibroids. That's the only way. Fibroid is difficult to prevent, so just what you tell so many people in many instances, that you have to be moderate in what you are eating, reduce all fatty diet, take more fiber diet and all that. That's still the general slogan. Otherwise, there's no specific diet you will take that you say, yes, this is what I will take to prevent me from having fibroid. As well, I advise people, go and eat. If the fibroid want to hit you, it will hit you. Just eat and enjoy yourself. But try and be moderate. Try not to gain weight so much. Whatever you can do to either lose weight or prevent yourself from becoming too heavy, we also help in preventing some of these morbidities.
Yes, he was asking, is it just to suppress the symptoms? Is there any medication that can actually cure? I'm using in his word, cure the fibroid, or the medications are just to shrink and keep the symptoms under control?
Now, there is no medication per se that could cure fibroid. Now, look at this instance. A woman who is around her perimenopausal period, if you use certain medication, it may take her to a point that she will stop menstruating. Suppress her ovary so well that she will stop ovulating. It will suppress these hormonal influences on the fibroid. Those fibroids will shrink, they will stop growing. Once you enter menopause, those estrogen and progesterone are at a very low level that can't really cause much of this fibroid growth. And the woman may not have the need to be performing surgery to control the problems of the fibroid. That's on one hand. But in every other aspect, it's just to suppress the symptoms and reduce the mass of the fibroid, even to make it easily operatable, by the gynecologist who is going to perform the procedure, particularly when the fibroid had been so massive. So basically, it's to control symptoms. Until such a time that surgery becomes feasible to actually carry out on the patient. But there are medications you can take to control the symptom for a very, very long time. Control the symptom very well, until the patient either get pregnant or is now ready to perform the procedure.
Somebody's asking, sir, he says, what is the best advice for someone that have had fibroid operation?
Okay, I really would want to mention this so much. What I will say is that if a woman who is strongly desirous of getting pregnant just had a fibroid surgery, the woman should make effort to get pregnant. Now, if the pregnancy is not coming, still after 6 months, after 1 year of performing this surgery, and the woman has investigated herself, have investigated the husband, and there's nothing seems to be, causing this inability to get pregnant again, such women should seek alternative way to actually get pregnant. You have waited for 1 year, it's going to 2 years. So it's better to begin to plan alternative ways. One of such ways is assisted conception, because such procedures are actually better. The successes are better when the fibroids are not there. There's no need waiting for a long time again, before you start thinking of having such procedure done. Once that procedure is done, you've spent 1 year, it's not coming. 2nd year, pregnancy is not coming. After 2 years, you begin to think of an alternative way to actually get that pregnant in. And fibroid surgery, it doesn't really kill. Yes, I heard somebody. I saw a question on that. Really,
yes.
It wouldn't really kill you except you meet a person who is not experienced in performing this procedure. Yes, complication could arise. The person may lead to more blood transfusion because it could be very bloody, and the patient could be giving blood. It could lead to even ureteric injuries, bladder injuries, bowel injury, but those can easily be repaired without causing permanent disability on the woman. So the worst that could happen is if the person bleeds too much and the fibroid probably was multiple, cervical, is probably difficult to actually remove fully. The person may end up removing the womb and keeping the patient alive. Such can happen. But to see a person dying for fibroid is particularly when performed by somebody who knows what he's doing. We have a